A recent report in the Lancet magazine, very highly respected publication in the medical field, it was stated that by 2030, over 1 billion adolescents will still live in countries where they face serious risks to their health and well-being unless urgent action is taken. And that's, 4.5 years away. It's not that far. Globally, the health of adolescents at a tipping point. One of the contributors to the report, Dr. Alex Ezeh, a professor of global health at the Dornsife School of Public Health at Drexel University, happens to be in South Africa at the moment. I know quite a few people who've spent some time at STIAS, Stellenbosch Institute for Advanced Study, and it does seem like a lovely break from more pressing teaching engagements and so on. Get the freedom to think and to write and to engage in conversation, collegial conversation with people from other disciplines. Anyway, Alex, a very good afternoon. Welcome to CapeTalk. Welcome to STIAS. I'm sure you're having a lovely time there.
Thank you, John. I'm absolutely having a lovely time here.
What are the biggest threats to the health of adolescents globally? I mean, there's this umbrella statement that globally the health of adolescents at a tipping point. In what respect?
Oh, thanks, John. I think there are a number of major challenges that adolescents currently face. And in addition to those traditional health concerns that are there, you're looking at, particularly in some regions, with major challenges with communicable diseases, as we see in Africa. We're also seeing very many different threats that are emerging. Here, we are looking at the roles that with recent COVID pandemic, that it has really affected adolescents, disrupting education and different other processes, and creating issues with virtual life and all that for them. We are seeing increases in mental health conditions, in obesity, and we have increasing dominance of commercial interests that's affecting the health of adolescents. We are looking at digital technology, which could be positive, but in some instances can also be negative. Climate change is another, and this generation of adolescents will be the first group that will actually live their entire life within a context where the increases in greenhouse emissions is at least at 0.5 above pre-industrial levels for the whole of their lifetime. So if we are looking for what impact climate change could have on humans, this is the group of people that are going to be experiencing it for the rest of their lives. So we are looking at all this and looking at what can be done with all these multiple intersecting challenges that affect adolescents specifically and in very unique ways.
And because they are unique ways and such a spread of unique ways, what it means is that there's hardly a corner of the globe where this isn't a problem. So the problem in the developing world, in Africa, Southeast Asia, parts of South America, will be different from the problem affecting adolescents in America or in France or in Germany or in South Korea. But adolescents in each of those geographies will have problems which are significant.
Absolutely. If you look at sub-Saharan Africa and some parts of Southeast Asia, we still deal with multi-burden of health conditions for adolescents. You're looking at challenges with communicable, maternal, nutritional, and neonatal diseases, which is very significant in the region. In Latin America and the Caribbean, you're looking at injury, deaths, and burden, which is massive within that region as well. And in the north and globally, actually, in almost every region of the world, issues of growing obesity and growing mental health conditions are significant threats to adolescent health. So in every region of the world, young people are facing these threats. And what we see particularly for the global picture is when you look at the growth in the adolescent population, what we are calling demographic shifts, where currently sub-Saharan Africa may be accounting for 1 in 4 adolescents, but by the end of this century, almost 1 in 2 adolescents will be in the region. And if they are experiencing worse health than other adolescents in other regions, then that growth in this region alone will significantly impact overall adolescent health globally. So we're also seeing the impact of shifting demographics in affecting what we see as the threats to adolescent health in a global when we take a global picture.
Thank you very much, Dr. Alex Ezeh, on the line to us from Stellenbosch, where he's currently on sabbatical at STIAS, but ordinarily Professor of Global Health at the Dornsife School of Public Health at Drexel University.